So what kinds of things should you be covering in training? Well, as we talked about, you really need to have a good general understanding of the HIPAA regulations. This is knowing about things like GINA, knowing that that information is also protected as protected health information, knowing that if a patient pays in full, that they then you can request not to have that information sent to their insurance company. You know, those ideas about what a breach looks like, how you're going to respond in a breach. So those are things you need to understand with HIPAA. How to use computers to access PHI. What's the appropriate way for that staff member to access the PHI? Using their username, password, how often that needs to be changed, what the security requirements are. Those have changed significantly since 2013, as we were talking about earlier, so making sure the staff understands that. How to recognize a hack. That's if screens look different, you're seeing login screens that you've never seen before. As we saw with the hospital out in LA, their computers were taken over by ransomware. So if they're locked out, they may have been able to stop that earlier if people had noticed changes before. And so it's notifying, having your staff feel comfortable to say to IT, hey, something's not right here. I'm not sure what's going on, and knowing that that's okay. How to use encryption. Encryption would be making sure total disk encryption is enacted on all your mobile devices, and also email and text. Text is really important. I know a lot of people like to use text. Using text that's on your iPhone or Android phone is not acceptable. As I said, we'll talk more about that in the next webinar about electronic devices. Your password policy. That's very important. That is probably, if not the most important thing for your staff members to know and to follow. Actually, I'm going to retract that. It is the most important thing. That is usually the weakest link for any sort of security program. And then understanding what those sanction policies are. Knowing that if they make a mistake, that there are consequences for those mistakes. It could be that that person goes through a retraining. It could be, if it's happened multiple times, that person is suspended or even terminated as an employee. I know that's not a fun thing to talk about, but it's very important, and it is required under HIPAA to have those policies in place and to train your staff and that they know and understand that those policies exist.